Welcome to the SVG-TV news for today, Thursday, January 20th. I'm Khalil Keita with the details. 2 new Covid-19 deaths and over 200 cases of the viral illness were recorded here between Monday, January 17th and Wednesday, January 19th. A 74-year-old female who tested positive for Covid-19 on January 6th and was admitted to the isolation ward at the Milton Cater Memorial Hospital died on Tuesday, January 18th of Covid-19 pneumonia. The other deceased is an 83-year-old male who presented at the Milton Cater Memorial Hospital, the MCMH, with symptoms typical of Covid-19 and tested positive on Wednesday, January 19th, and later died at the MCMH. He was determined to have died of Covid-19 pneumonia. Both patients were unvaccinated. Their deaths bring the death toll from the viral illness to 90. Meanwhile, 3 positive PCR cases were reported from 20 samples collected on Monday, resulting in a positivity rate of 15%. 123 new rapid antigen positive results were also reported from flu clinics on Monday. 7 new positive PCR cases were reported from 16 samples collected on Tuesday with a positivity rate of 43.8%. 92 new rapid antigen positive results were also reported from flu clinics on Tuesday. The Health Services Subcommittee of the National Emergency Management Organization, NEMO, said the current COVID-19 testing algorithm, based on the WHO recommendations appropriate for this phase of the current outbreak, reduces the number of RT-PCR tests conducted, relying more on rapid antigen and clinical diagnosis. No patients have been admitted for COVID-19 at the Argyle Isolation Facility. However, 28 patients were admitted to the COVID-19 ward at the Milton Cater Memorial Hospital, 2 of whom are pregnant and 1 younger than 18. 6 of the admitted patients are vaccinated, 2 partially vaccinated, and 20 unvaccinated. 14 recoveries were noted over the reporting period. 873 cases are currently active and 90 persons with COVID-19 have died. 6,615 cases along with 5,652 recoveries have been recorded in St. Vincent and the Grenadines since March 2020. The Ministry of Health, Wellness and the Environment has extended the use of the home rapid antigen test for the diagnosis of COVID-19 for the period January 18th to February 6th. The ministry said the following recommendations should, however, advise the use of these tests. 1. A positive rapid antigen home test will be registered as positive by healthcare providers and reported to the national epidemiologist. No further testing would be required. Clearance from isolation must follow the recommended period of 5 days for vaccinated persons without symptoms and 14 days for unvaccinated persons. 2. Persons who test positive are asked to call their nearest flu clinic or private healthcare provider to log their information, which will facilitate the required sick leave or NIS documents needed. 3. If symptoms worsen in a person who tested positive with an antigen test, the person is advised to contact their nearest flu clinic or private physician for assessment, as persons can deteriorate rapidly if left unmanaged. The ministry also wants the public to know that the use of rapid antigen test kits should be WHO, FDA, EU listed and in use in the country of manufacture, noting that the tests currently being used in the public system are Standard Q, Abbott, Zenrui, and Roche. The ministry said it will monitor the situation and provide further guidance and updates where necessary. Locally trained nurses will be bonded as government moves to have them provide more years of service to the country. This was announced on radio yesterday by Prime Minister Dr. Ralph Gonsalves, who said that he has spoken to the head of the SVG Community College, Nigel Scott, about the issue, along with the Chief Personnel Officer. The Prime Minister said the bonding will commence with the current batch of nurses pursuing the degree program at the Community College Nursing Division.
We have to do, including those who are currently on the program, we have to do a bonding. Remember, this program is hundreds upon hundreds, running into thousands of persons we have trained as nurses and nursing assistants, I mean, we spend millions expanding the nursing school, increase the staff, do all sorts of things. And we do something for our nursing students here, which people don't do otherwise in the region.
The Prime Minister said he understands the reasons why nurses are leaving the system, but the government offers them a monthly stipend while receiving training, and they should be considerate.
The world has to be in a balance for things to work. I don't begrudge anybody who wants to go overseas and get an opportunity to work and the like. But surely, I mean, you can't just use the system in a way. You get a free education, 2 or 3 years, or in some cases 4 years, or near free. You get $1,000 a month. I pay you to go to school, and then immediately when you come out, you get a year on the set, for instance, which is a set nurse is $1,500 a month. And then you say, well, you want to get appointed. And I could understand you want appointed. But you want to get appointed as a staff nurse. You don't necessarily have it in your mind to stay, to give a few years service. Shortly after you get appointed as a staff nurse, you jump on a plane and you go on somewhere else.
PM Gonzalez acknowledges the demand for nurses globally and said that not everyone should want to leave at the same time to take up opportunities elsewhere, noting that the circumstances have now changed.
With the COVID, a lot of countries need nurses. So there's a great demand, greater than usual. But you can't turn your back. Everybody can't go and turn their back on we who pay to train them.
Right.
You know, normally, as I say, when you had an overabundance, and though there was a big demand, there wasn't like now there's a real crazy demand for nurses, you know. But Heavenly Father, I mean, if we train you, we give you a free or near free nursing education, we pay you $1,000 a month. Conscience must tell you. You can't tell me, well, you do 1 year, I do 2 years. You got to give me a little bit more than that, man. So I wasn't encumbering the young people, but the circumstances have now changed.
In the early stage of the 2022 budget debate in Parliament last week, it was revealed that several government MPs contracted COVID-19, including Minister of Finance Camilo Gonzalez, who was deemed to be positive hours after delivering the budget presentation on Monday, January 13th. On radio yesterday, Prime Minister Gonzalez said that most of the ministers have been cleared, but he is still decided against holding cabinet, which was postponed to today.
Camilo is cleared, but a member of his family who lives with him in the house is not cleared yet. So he has to help with the domestic arrangements now. They want to keep that person from others done. It's so if people don't see him, it's not that he's actually cleared. Jimmy, I need to find out this morning. Jimmy was either was supposed to be cleared yesterday or today. I want to give until tomorrow now, so that I'll have the cabinet tomorrow. Make sure that everybody, and I'm hoping Pitbull will be cleared too, though he's no longer a senator.
As for former Senator Rushad Bala, whose appointment was revoked, Prime Minister Gonzalez said Bala will continue to work at the office of the Prime Minister once cleared of COVID-19. However, there will be a change in his salary.
I told him that he must still come down. There's work for him to do.
Okay.
You know what I mean? And his emoluments should be paid in a different way, not a senator, because I think from the way I spoke, as you know, it's not that Pitbull is going to be long out of the house.
Last Friday, Bala, who tested positive for COVID-19, was replaced by lawyer Rene Batiste in a move by the government to ensure there were enough MPs in Parliament to have the 2022 budget passed. Newly appointed government Senator Rene Batiste said Budget 2022 is for all Vincentians. Making her contribution to the 2022 budget debate in Parliament last Friday, hours after her appointment, Senator Batiste said she supports the budget fully, as it lays out great plans from which all Vincentians will benefit.
All for the benefit of the people. All of the people. I haven't seen anything in this budget which indicates that it is only for one set of people. But the budget focuses on reducing inequality. It focuses on the people who need it the most. For someone like me who I like to listen to so many different newscasts, and you hear them talking about the frontline workers, the workers in the hospitality industry, the workers in the health sector, the workers doing the sanitation, the construction workers, all over the world. St. Vincent is not the only place. But we are one of the smallest countries in the world which have had to grapple with this.
Senator Batiste, who retired from active politics 11 years ago, said the younger generation is making strides under the ULP administration, making reference to the young government ministers whom she said are making a difference in the lives of Vincentians.
But I see there is this continuing, what he calls the continuing quest, especially in the area of agriculture. I want to compliment the Honorable Minister of Agriculture and his team for the work that they're doing, and their young energies have now been able to be put to full use to indicate that you don't just sit by being and say you're young. You must show me how young you are in getting the work also done, in pulling your team together, showing the leadership qualities that are required of you. Every age, there comes a time when you will be tested, and this is the time when the young Minister of Agriculture, the young Minister of Tourism, the young Minister of Social Development, this is their time to bring their energies, their talents, their skills, and of course, the ambition to serve the country and do well for the people of St. Vincent and the Grenadines.
In June 2021, 2 months after the eruption of the La Soufrière volcano, the government of Japan donated emergency grant aid for SVG to the tune of $1.58 million. The monies were handled by the World Food Programme and International Organization for Migration, IOM, to execute several programs and projects. Speaking at the groundbreaking ceremony on Tuesday for rehabilitation work to commence at the new site of the Louis Bonnet home in Orange Hill, Japanese Ambassador for CARICOM, His Excellency Tatsuo Hirayama, said he is pleased with the outcome of their support to SVG.
Today I'm very glad to see the results of our assistance on site, at the exact site, and also meeting people who are affected by the disaster, but who get benefit of our programs. That makes ourselves happy, because we are always, as I said, when the disaster happens, we have to help each other, cooperate with each other.
Ambassador Hirayama said he was happy to witness firsthand the progress made on the projects in SVG.
Makes our government delighted to see the progress and outcome of our assistance to St. Vincent and the Grenadines. So it's for me it's a happy day and delightful day, nice weather, and good day to come to this former affected area.
Meanwhile, Ambassador Hirayama announced that his 3-day visit to SVG this week as Japan's ambassador to CARICOM was his final one in that capacity, as his tenure comes to an end in a month's time.
Before I conclude, I have to touch upon a brief personal note. I'm completing my assignment in the Caribbean. I'm based in Trinidad, but from Trinidad I cover OECS countries. But I'm completing this assignment in next month and leaving the Caribbean for good. But before I leave, once again I like to say that I'm extremely pleased to come back to this country to witness some of our good relations, cooperations, partnership between Japan and the St. Vincent and Grenadines, and also the UN groups.
Ambassador Hirayama made several visits to SVG during his 3-year stint as Japan's ambassador to CARICOM.